Good day, everyone. Welcome to class. Yeah, so we are moving quickly to the next module, which is module 8B. Taking a brief recap of the previous module, where we talked about still on physical disabilities. And I could remember that we talked about how physical disability can impact what is a type of physical disabilities, as we talk about the permanent and the temporary. And we talk about the different aspects in which physical disabilities can impact someone's life and the need for support groups and how healthcare aids can come in. So quickly today we are moving to how home health aids or the personal care aids can help a person with physical disability. We've been able to understand the impact of physical disability on the social, emotional, physical, in fact, the total well-being of those involved or those in these shoes, in this step. We'll be able to understand how detrimental, how devastating, how frustrating, how bad physical disability is. And we also need to understand the things we could do to help. As we know that the reason why we would decide to learn about a disability or to learn about a thing is not because we just want to, or because we have will to help. So now we've come to one of the crucial parts of what we are doing, which is how can we help a person with physical disability? As we know that helping a patient or helping a person, there is a technical know-how. Because when you help in a wrong way, you may in no wise help. Instead, you make the patient even feel more pain. We want to learn how we can help a person with physical disability as home health aids and personal care aids. So the first thing we are talking about now is maintenance of dignity and self-worth. I believe it's not the first time we are hearing the word dignity and self-worth. Even in our previous module, with one time or twice or times like that, mentioned dignity and self-worth. So when caring for an adult with a physical disability, it is the same as caring for any other adult in that sense. Because why? They all have what? The same basic needs. We're able to understand before in the previous lectures the Maslow's hierarchy of what? Of needs. And we're able to understand that everyone, every living thing, every human being, either able-bodied or disabled, have the same basic needs. We have both of it, the same physiological needs, the same safety needs, the same love needs, same esteem needs, and self-actualization needs. We all exhibit the same needs. In fact, those that are disabled even tends to be more demanding than the normal able-bodied persons. Why? Because some of these things that they would have done for themselves to satisfy that needs of themselves of theirs, they can't due to the disability they have. So when caring for an adult with a physical disability, either adult or child, or notice that the same need you, if you're an adult, has is the same as the person's needs. They need food, they need water, they need safety, they need love, they need sense of belonging within their family and community. They need social interactions and to develop a sense of what independence and self-determination. Now, unlike other adults, they may require additional care. Now, this care may be temporary or permanent, depending on which category their disability falls in, either permanent or temporary. Before that temporary, we know for the meantime, and when they regain, when they heal up, when the healing process takes place, they regain the ability to do those things for themselves again. But otherwise, they have to, this care becomes demanding for the rest of their lives. So due to their disability, they may not be able to do the same things as other adults or the same thing they once were able to do, such as live independently or go to work or provide their own self-care. Now, or they may be able to do, they may not be, or they may be able to do some things by themselves, but they need some additional support. Some of them can do some things for themselves, but they need people to support them more. And they begin to learn how to adapt with special equipment, like in terms of walking, those that work with the walking sticks, the workers, we call them workers. Those that work with workers, they tend to start learning how to balance themselves on the workers. So when they start, they may fall once or twice before getting themselves adapted to the special equipment. So it's very important to remember that just because these adults may have impairments, they are not children. Now, there is this normal scenario where if a child doesn't perform well, you yell at them. When the child is learning, you force them to learn, especially in the African part of the country, African world, African of the world, the Africans. We force them, we beat them to learn. We believe that's how to make them learn. So understand that these adults, they are not children. You cannot force them. You cannot impose them. They also have will. They are only a victim of circumstance. So they are not children. Even if they need to have complete care, they should be treated as an adult. You must be respectful, you must be cautious, and you must be kind. I repeat those keywords: respectful. What do I mean by respectful? You know what the word respect is. You must be cautious, be orderly. Don't just be too shabby or uncoordinated in your dealings with them. And also, you need to be kind because these three things can even give them if they are missing in your care, it can give them even a more traumatizing emotional scenario situation. So you have to be very respectful to them because they tend to be very sensitive in this case. They are kind of very sensitive. They read your eye movements, they read your body languages, they read everything, and they see themselves as bad. They see themselves as the one, the victim here. So they see themselves as bad. Whatever they do, they feel like when you don't treat them carefully with respect, cautiousness, and kindness, they tend to even feel more less of themselves, and it can be really traumatizing for your patients. So we have to promote the patient's dignity by being mindful of providing privacy. Privacy is important. When dealing with them, you provide privacy, you just intrude their private life. You take some, you respect confidentiality, including them in decisions respecting their privacies and their rights, and also valuing their differences. Respect confidentiality. You don't just talk about them anyhow, just tell other people about them, just talk, this, no. Respect confidentiality. Then include them in decisions. Don't just make decisions for them. This is what you have to do and you have to do it. No, ask them, what would you like to do? Give them choices to make. Would you love to, let's say you want to take their bath, would you love a warm bath or a cold shower or a cold bath? Let them decide. Don't just decide what they will do for them and respect their rights. Every human being has rights. Those that are able-bodied and those that are disabled, they all have rights. Disability doesn't impede their human rights or doesn't take away their human rights. They have to respect their rights, rights to speech, rights to life, rights to fair hearing, and other rights as you can mention. They have that right. So you respect that right and you value their differences. Everyone is different. We have different ability to cope, we have different adaptation ability. There is no individual that is replicated. We can have a look-alike, but we can never have a same. We can never have the same. So understand that what everyone is different. So when you're dealing with two patients, you don't expect them to behave the same. You don't expect them to learn the same. You understand that what they are different. So you respect their differences. So be cautious, be respectful, and maintain privacy. This is represented in the diagram there. So secondly, we have preservation of normal lifestyle. Now, as we know that physical disability has, in one or several ways, shifted or affected their normal lifestyle. Someone whose normal lifestyle is wake up in the morning, take a bath, go to work, come back from work, then do a little game, maybe go to field, play play football, just have fun, come back at night, cook, go shopping, come back, That's a normal lifestyle. That's how they live their life. Now, physical disability has what interrupted this plan. Such a person may not be able to go to work, may not be able to do those activities that give him, joy, like maybe some that derive pleasure from playing football. So those pleasure lifestyles gone, work life gone, and so many other things. So their lifestyle has been shifted, no longer balanced. So it's important to remember that when you are dealing with this kind of patients, you provide and assist the patients in having as normal life as possible. Now, I said as normal life as possible because we cannot 100% bring them back to their normal life at that stage of disability, but at least and as most as possible, we make them to live a near normal life as possible. Now, if such a person would literally love to play football, that means he has love for ball. Even in a wheelchair, you could, engage him in handballs, like throwing ball. Like that would, fine. He's not really playing soccer, but at least he's not far from the field. So helping them to maintain a near normal life as possible. And this means working to support the patient's physical, emotional, social, and spiritual needs. I repeat, you help the patient to what support them with what the physical, emotional, very important, social, quite important, and what spiritual needs. Home health aides and personal care aides should seek always to provide an environment in which their patients can be safely independent. Safely independent in what sense? You can't force them to play ball. When you force them to do things, this is someone who had a leg fracture and is even working with a cane, of course, he can move. You're not making the person to hit or to kick a ball with that leg. Oh, you can do it, do it. They're no longer safe. Good. So we are trying to make them independent, but safely independent. So not just making them independent, but what safely, because if you like for example, the instance I cited just now, someone who had a fracture and you're making him to play something with that leg, is that safe? That is not safe. So you're trying to make him independent, at least maintain his normal lifestyle, but then it's not that safe. So that's wrong. So you teach them to use adaptive and assistive equipment like the crutches, the walkers, the wheelchair, the assistive equipment. We encourage them to complete tasks independently as much as possible. At least if they could still, if the legs are not working, that doesn't mean the hands are not working. So such a person may at least be able to wear some shirts for themselves, be able to brush by themselves, may even be able to feed themselves. But you don't do everything for them. At least allow them to perform some tasks independently as much as possible. You provide encouragement and praise. For anything they do, you praise them for it. For anything they try to do, you encourage them that they can do it. Even if you feel as if they are slow, they're not coming up as much, you don't blame them, you don't condemn them, you rather encourage them and praise them. At least that gives them more morale to try more. Seek opportunities for the patient to socialize with others, to make choices, and to be independent, as independent and self-reliant as possible. For this example, this is a guy who is not. This is a girl here, at least having what's it called, the basketball being thrown like that. The girl helping the other person with the crutches, and the guy on a wheelchair who's playing his strengths. So, still on preservation of normal lifestyle, we continue that adults with physical disabilities also have sexual desires and needs, just like any adult. Now, having disability does not mean that they are incapable of sexual or emotional intimacy. So, people who have physical disabilities may need to make adjustments during sexual intimacy. But this does not mean that they are not capable of having sexual relationships and they do not desire or have sexual feelings. Never make judgments or assume you know the sexual needs or behaviors of a person with a disability. Always be respectful of times and needs of times needed for privacy. So the fact that you're taking care of uh, an adult with a physical disability doesn't mean that they've lost their ability to make lost their sexual desires. Now, disability doesn't make them impotent. It doesn't make them incapable of emotional intimacy or sexual intimacy. Some of them may have spouses. So you don't intrude, we're talking about privacy again. You don't intrude privacy. You respect times needed for privacy. You don't have to be there 100%. When they need to be excused, you excuse them. Although you are not to leave them alone, meaning that you just abandon them, okay, just go. No, 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 that's not it. Give them privacy, but paying attention to what the details as to when you need to come in. Yeah. So, what are the role of home care aides or personal care aides? What are your role as a home care aide or personal care aide? Before starting this point, I would like to make a brief recap so as to be sure that we are going together. So we started with um, how home health aid can help a person with physical disability. Then we picked some important points as maintenance of dignity and self-worth. And we also pick another point where we talk about preservation of normal lifestyle. Now we want to consider the roles listed out in points of a home care aide or a personal care aide. Now the role of a home health aide or personal care aide will vary depending on the needs of the patient with a physical disability and their family. Two things we consider to decipher what our role will be. What type of family does this person come from? And what kind of physical disability does this person have? Now, the care plan will direct them as to what their patient's needs are and the task that are needed to be what to be performed. Whenever in doubt about what you should do or what you'll be doing for your patients as a home health care aide or personal care aide, to seek guidance from the supervisor and you ask for clarification. Some moments can be confusing. As okay, what is within my job here? The family where there's a person that there's a disabled person and he has family members who can assist and do this. So you kind of what is my job here? So you ask your supervisor for clarification. Remember that the patient's needs and goals always comes first. In any scenario, in any situation, no matter the confusion, no matter the case, remember that your patient's needs and your the goals always comes first. To help promote self-determination by encouraging them to set goals and helping them to achieve their goals. So even if you are not brushing for your patients, even if you are not beating them because maybe they have a family member that is doing that, you must understand that their physical disability has impeded and impacted them in so many ways, as to even reduction in what in self-belief. So we are encouraging them to what believing in themselves and promoting self-determination to achieve what their goals. For many patients, home health aides or personal care aides will assist with providing or assisting to provide self care. It is either you provide self care or you assist in providing self care. Providing self care for a patient that is completely independent and assisting to provide self care for people that are not completely independent, that at least they are, they are not completely dependent. The personal care skills learned in previous modules and I'll be learning future modules in this course will be able to help you use them well when working with a patient with a physical disability. This includes bathing the patient, skin care for the patient, dressing the patient, toileting, that's taking the toilets, feeding them, and assisting them with what ambulation that is moving from one place to another, or use of adaptive equipment to move from one place to another. So part of the job of a home health aide or personal care aide, when I say HHA or PCA, we know what it means. So while working with a personal person, with a person with a disability, may be to help them learn to safety use of adaptive equipment, such as the eating utensils and the transfer device, such as maybe wheelchairs and things. Safety use of adaptive equipment because it could uh, accidentally something can happen and the wheelchair, they may even get an accident on wheelchair. So you have to teach them how to safely use those adaptive equipment and even the chains. This will help promote independence for the patient. HHA or PCA, just keep in mind that safety comes first. Keep in mind safety risks, and you work to provide a safe and clean environment for patients. When we talk about safety, we are not just talking about safety from harm. What type of harm? I'm talking about safety from maybe from falls, from physical harm like trauma and the likes. We're talking about safety from infections because infections can be very detrimental and dangerous as well. So we are both making the environment safe, that is a clean environment, a hygienic environment for the patients, and as well as an accident-free environment for the patients. You ensure there are accessible routes for the patients in case of an emergency. Ensure that there are accessible routes for the patient in case of emergency. And if the patient's home requires special adaptations to provide for the patient's safety and independence, such as maybe wheelchair ramps or safety bars and showers, speak with the supervisor about these needs. So if you need to, if the home of the patient requires this special adaptation to provide safety, you have to speak to provide these needs because safety is important. Another thing here is home health aides or personal care aides, especially your PCA, will monitor their patient's health as directed by the care plan. So there's a plan, the care plan, so as directed, as instructed there, you will monitor the patient's health, the vitals, and the likes. They may also be asked to measure intake and output. They may assist with shopping, housekeeping, meal preparation for their patients. You provide food and you cook for them. You keep the house. You go shopping. And you need to provide respite for the family or assist with child care using good communication skills is also important and essentially important in doing the job well and meeting the needs of the patient. We've talked about communication skills in previous models, and we can't overemphasize that good communication skills is very important because there are negative words and positive words. Though to a layman or to a literal person, they may not look bad, but to those who are physically disabled, they are not good words. Like we said in one time in our lecture that when you see someone is mentally retarded, they have mental retardation. That's a very big word. But medically, it's not really bad. It's only explaining a condition, but using that for them and they hear about it makes them feel bad. So good communication skills. When you are talking to them, we are careful what to say and how we say it. Never assume you understand their individual Never assume you understand their individual experience. Allow them to allow them the space and time to express themselves. We talk about rights. And if you have rights for expression, rights to speech, if they have the right to talk, give them that right. Let them speak for themselves. Let them express themselves. Don't just assume you know what's wrong. Oh, it's high, let's say fine. I have my patient who has maybe a problem with the spine, and because of that, he or she can't walk. So I think that because I will just assume this is what the patient needs. No, ask them and allow them to express themselves. This is a picture of a man going shopping with the patient, helping them to maintain their lifestyle, someone supporting the patient for ambulation, and someone moving the patient or talking to the patient to make him happy while on a wheelchair on a seat. And that's a cane with the man. So moving to the next point, under the roles of a home health aide and personal care aide. As with all patients, an important part of the job of a home health aide or personal care aide is always to be observing and documenting changes in physical, mental, and emotional or social health. Observation is key in any health field, like medical field. Home health aide, personal care aide, community health practitioner, medical practitioner, a nurse, whatever it is, observation and documentation. Why? The patients may, at the time of commencement of care, may not have emotional crisis. But over time, due to some environmental factors, social factors, or even personal factors, personal feelings, they may begin to develop emotional issues that could affect them mentally. We are to be observant to know how a patient a patient who could at least try and tip on his toe, maybe with the cane, try to walk before. Over time, can't even move from a place to another. You can see that the condition is deteriorating than getting better. Mentally, the pain was okay before, but then at the point it begins to be overthinking, start feeling aggressive, start feeling drawn away, this withdrawal syndrome. Or the patient's social health is disturbed. Maybe the person doesn't before, so at least go around the neighborhood, talk with friends. But now he's not. He doesn't even want to go. He doesn't want to see people. He doesn't want to be involved in people's business. So we see that the patient is what, rather than getting better, is getting what, deteriorated. So you report any issues of concern to your supervisor immediately, and always document observations and tasks that you completed. Always document. Because one thing is, when you do a task and you fail to document, it is same as you've not done it at all. So you have to be careful that whatever you do, the observations you make and the tasks you've completed, you document. The watchful of issues of concern in the home, such as domestic violence, substance abuse, or child abuse. Then report any concerns to a supervisor immediately. How home health care aids or personal care aids help a person with a physical disability. And we talk about two main things, which is maintenance of self worth and dignity. Or let me say it in the proper way, maintenance of dignity and self worth. Then we also talked about preservation of normal life. And we were able to expatiate and we talked about a lot of things that are the do's and the don'ts in maintaining what preserving normal lifestyle and maintaining dignity and self-worth. Then finally, we now talk about the rules. What are the rules of a home health aid? When we talk about a lot of things, we're able to expatiate, talking about what the goal of the patient coming first. We talk about the fact that you also document, which was the final part of what we discussed, about documentation as a very important part. We talk about observation too as a key and integral part of our work. And finally, the last thing we spoke about was to report any concerns to supervisor immediately. If at any point you get confused as to the type of care to render, if maybe there is something of concern like child abuse, domestic violence, substance abuse, or the patient's condition is getting bad or worse, or it's deteriorating than getting better, you report any of this. This is a matter of concern, of course. So you report any of these concerns to the supervisor immediately for effective care. Thank you for your time. Have a wonderful